Good afternoon and welcome, everyone. Thank you for joining us today for Healthy Climate Maryland's annual Children's Environmental Health Day webinar, which this year focuses on the impacts of fossil fuels on children's health. We have a great hour planned full of information, resources, and opportunities. Children's Environmental Health Day is based on the idea that together we can create a healthier, safer, more equitable world for all children, where fewer children suffer from preventable health issues. Focused on action and equity, the goal of Children's Environmental Health Day is to collectively increase the visibility of children's environmental health issues while empowering individuals and organizations to take action on behalf of children nationwide. Thank you to our partners at the Children's Environmental Health Network who started this movement. I'm Rebecca Rear, Director of Climate Policy and Justice at the Maryland League of Conservation Voters and the Maryland League of Conservation Voters Education Fund. Our vision is a healthy environment for everyone in Maryland, and we do this by educating and activating people to take equitable and just political actions for clean water, healthy air, and climate-resilient communities. Along with the Maryland Public Health Association, which is the American Public Health Association state affiliate, and whose mission is to champion health equity for Marylanders through advocacy and community collaborations, we help support Healthy Climate Maryland. Next slide, please. Healthy Climate Maryland is part of the Climate and Health State Network of the Medical Society Consortium on Climate and Health, and we're working to educate, advocate, and build strong partnerships towards a healthier, more sustainable future for Maryland. Next slide. We are a network of health professionals across disciplines, and our mission is to address climate change and environmental challenges by focusing on their impacts on public health. You can find more at healthyclimatemaryland.org. Please join us. Next slide. Today, we are joined by two wonderful speakers, and we're excited to offer one nursing continuing education credit for this webinar. If you indicated on the registration that you would like to receive credit, you'll receive a separate follow-up email with instructions. Dr. Ruth McDermott-Levy is a professor and co-director of Mid-Atlantic Center for Children's Health and the Environment, which is the U.S. Region 3 Pediatric Environmental Health Specialty Unit at Villanova University's Fitzpatrick College of Nursing. She's going to provide a comprehensive overview of today's topic and tell you more about pediatric environmental health specialty units. But first, I am delighted to introduce Meghan Conklin, who is Maryland's Chief Sustainability Officer, the first sustainability officer for the state, who has a wealth of experience in climate and clean energy policy and was appointed by Governor Moore in 2023 to this role. Meghan is here to bring greetings from the governor and offer a special proclamation. Meghan.
Thanks, everyone. I am Meghan Conklin, Chief Sustainability Officer to Governor Moore. Special thanks to Rebecca for the invitation to be here with you today. There is nothing in the world more important to us than our children. I'm the proud single mom of twin boys who are 12, and I am also a foster parent. My children are definitely my top motivator for working to protect our environment, as I know the same goes for many of you on this call. We all want to leave our planet in a good place for our children and for future generations to come. So I'm proud today to present this proclamation from Maryland Governor Wes Moore proclaiming October 9th as Children's Environmental Health Day. The proclamation states, whereas the aim of Children's Environmental Health Day is to raise awareness about the importance of clean air and water, safe food and consumer products, healthy environments, and stable climates to children's health and development, and the Children's Environmental Health Network established in 2016, which is now observed annually on the second Thursday in October as a means to celebrate the progress of the children's environmental health movement and create a strong network of child health advocates. And CEH Day is a national effort supported by individuals, nonprofits, organizations, and government agencies. And CEH Day encourages individuals and organizations to raise awareness and understanding of children's environmental health issues, seek improved protections for all children, and perform acts of sustainability or environmental health and wellness. And children are particularly vulnerable to the impacts of climate change and fossil fuel pollution. and together we can safeguard the health, safety, and well-being of our most precious resource, children. Therefore, I, Governor Wes Moore of the state of Maryland, do hereby proclaim Thursday, October 9th as Children's Environmental Health Day in Maryland and urge residents to observe this day with awareness raising and environmental health and stewardship activities to create a healthier environment, resilient climate for our children. Thank you again for the invitation to be here today. I look forward to hearing the rest of today's program, and I'll pass it back to Rebecca. Thank you.
Wonderful. Thank you so much, Megan, and thank you to Governor Moore for his leadership and for today's proclamation for Children's Environmental Health Day. With that, we're going to turn it over to Dr. McDermott-Levy to take over the presentation. You can go ahead and start your slide share, and over to you. As Dr. McDermott-Levy is going through her presentation, please feel free to enter your questions in the chat, and we will get to as many as we can before the end of the hour.
I'm trying to, excuse me, bring up my video picture of myself. I guess I will do that afterwards instead of holding things up. I shared it before I had the opportunity to do that. So, wait a minute. Excuse me, I'm going to stop share because now I'll do that. Okay, sorry about that, everyone. Okay. There, it should be in slideshow. Okay, so thank you so much for Maryland's League of Conservative, not voters, yes, conservative voters, I beg your pardon, and also Governor Moore's office for the proclamation. As you heard, children's environmental health is critically important, and as Governor Moore stated, our children are definitely our future. I am Ruth McDermott-Levy. I am the co-director of the Mid-Atlantic Center for Children's Health and the Environment. And what that is a part of the Pediatric Environmental Health Specialty Unit Network. And we cover, the country is divided up by Department of Health and Human Services regions, and we all are in Region 3. And so that is Pennsylvania, Maryland, Delaware, Virginia, West Virginia, and the District of Columbia. And what we do is we educate both healthcare providers and community members about children's environmental health risks and reproductive environmental health risks. And we also do what we call consultations. And so if you or someone you know have specific environmental health concerns and risks, we can help you navigate through those. We do not do the acute part. That goes to the Poison Control Center. If there's an acute, perhaps chemical exposure, Poison Control takes care of that. But we address everything else, and we do collaborate together. So if you end up with us, we may send you to Poison Control or vice versa. But because we're part of a national network, we also have experts across the country. So if we can't help you, if there's something rather unusual, we can talk to toxicologists, in other regions. We all collaborate and work very well together. So it is a wonderful resource, and we are funded by federal agencies. We are funded by the Center for Disease Control, and that is through the ATSCR, which is the Agency for Toxic Substance Disease Registry, and we're also funded by the U.S. Environmental Protection Agency. If I mention any trade names or any other products, it is not stating that CDC or EPA supports any of those products. I tend not to, but I might say them as an example. So that does not demonstrate that any of these agencies support those products. So we're going to talk about fossil fuels, and really that's about energy. And we all need energy. I mean, we're on this webinar now using energy. We probably drove to work or drove to the grocery store. We use refrigeration to keep our food cold. We use perhaps gas stoves to heat our, to cook our food. And I'm a nurse, so in healthcare, we use a lot of energy. And so sometimes when I talk about these things, people get very upset saying, well, we need energy, and absolutely we do, but we need to come up with better ways to support certainly our children and all of us. So a quick review of what Maryland's energy use is. First of all, the state's doing an overall good job with energy conservation, and they are among the 10 lowest energy states that use energy. So good job for Maryland. But it's important to look at where is that energy being consumed, and a third of it is through transportation. And the next one is through the residential sector. And so a lot of times you'll hear people say, well, what I do doesn't really matter. And if we think about the residential sector, if we all do, make changes, it does matter if almost a third of the energy comes from that. And so those are the two big areas that we need to think about targeting when we think about how do we reduce our energy use and think about conservation. We are talking about fossil fuels today, and so the two that I'm going to be speaking about are natural gas and coal, because that's most of where Maryland gets their energy from. Of the natural gas, some of it comes from Pennsylvania, my home state, and then also from the Gulf Coast. And so there's pipelines, and we're going to get into that and that's impact on children's health. And thinking about power, generating power of the natural gas that is coming into Maryland, 42% generates electric power, and then it kind of moves down. And I'm not going to read the whole slide. These slides will be available. Coal power plants within Maryland is about 59% comes from my own state. I don't know whether to apologize but Pennsylvania is an extraction state. That's just unfortunately who we are. And then from those coal-fired power plants, 75% of that is energy, for the residents, and then 25% is industrial. There are nuclear plants as well, but we're not going to get into that again because we're focusing on fossil fuels. Also, there is some oil use, but as I said, the largest are natural gas and coal, so that's what we're going to focus on. In 2022, Maryland legislature enacted a law to reduce the state's greenhouse gas emission to 60% below the 2006 levels. And the goal is by 2031 to reach net zero emissions, in 2031 to reach net zero emissions by 2045. And that sounds like a long way away, but it's really only 20 years away. And we all know time goes really quickly. So, there is hope for reducing our emissions. To do that, you need renewable energy, and Maryland's solar energy is about half of the state's renewable energy, primarily from solar farms and rooftop. There's also the Conowingo hydroelectric station, and that is on the Susquehanna River, and that provides 2/5 of the state's renewable energy. And then 1/5 of the renewable energy is onshore wind. There's a lot of opportunity in offshore wind for the state, but right now the federal government is not supporting offshore wind, and that would be a whole nother conversation about that and communities' reaction to offshore wind. So we're here to talk about children's environmental health related to fossil fuels. I just wanted to kind of place things where they were for the state. And so one of the things, if you're not a healthcare provider, just a little warning, we tend to talk about risk constantly. And so this can be overwhelming if you're not used to thinking like a healthcare provider, because you stub your toe and oh my gosh, it's a risk for an infection, and then you could lose your toe, and it goes on and on and on. So again, there are risks, and they are serious, but that does not mean it happens to everyone. And it also means that there's things we can do to protect people. So I wanted to have that disclaimer. So what's really important when we think about children and think about environmental exposures, they are not the same. Children are not small adults, and we hear that a lot if we work in pediatrics. They are developing humans, and so their organs are still developing. For example, their lungs don't fully develop until they're in their 20s, until children have reached adulthood. Their brains and central nervous systems continue to develop. We see this in toddlers, we see it in adolescents. And every system is continuing to develop, and because of that, we don't want to, or we want to reduce to the best of our ability any environmental exposure, because that can interfere with the healthy development of a child. And so they are unique and have special vulnerabilities. So we're going to move into coal-fired power plants. So I'll talk about that, natural gas, and how the infrastructure of that and how it affects health. And then we're going to talk about some strategies that we can do to reduce risk both at state and community level and individual level. So proximity to coal-fired power plants does come with air pollution. And although there are regulations related to the power plants as far as what they can release, there are sometimes planned releases and unplanned releases, and sometimes the operators may not be as honest as we'd like them to be. And so I'm sure you've all read about those sort of events. But the typical things that are released are particulate matter, which are the small particles that can either get trapped in the upper airway, or if they're very small, can go way down into the lungs and actually get into the body. The issue with the particulates or the particles is not only are those particles or those little pieces in the air, is they also carry other contaminants. So even though it's tiny, if you get enough of those in your body, it can be very problematic. Nitrogen oxides can cause irritation to the eyes and nose and throat, and also cause poor lung function. And then if it goes on long enough, it can cause fluid in the lungs. So that can be very problematic. It's also related to asthma and chronic obstructive pulmonary disease and respiratory infections. And also in children, it also can be exposure to nitrous oxides can be a problem leading to ear infections. For sulfur dioxide, we get complaints of burning in the nose and sore throat and an altered sense of smell. And this also, with enough exposure, can lead to asthma and COPD and upper respiratory infections. I've done some work with your Baltimore Health Department, and I do know asthma is a big problem in the state. And then polycyclic aromatic hydrocarbons are actually, the aromatic means they have an odor, and it's actually like the gasoline smell. And these are known carcinogens, mutagens, and tetragens, meaning they can cause cancer, they can affect our DNA, and they can also affect the developing fetus. And so these can be very problematic and lead to cancer in many organs. I'm not going to list them all, but the note section is in the bottom of the slides that you will receive. And then the metals, heavy metals, are known neurotoxins. Again, the children's brain is still developing. We do not want to expose them to anything that's going to be causing problems for neurological development. So in a systematic review, which is a review of many, in this particular one, they looked at epidemiological studies. They found that there's more respiratory illness for children who live near coal-fired power plants, and also higher rates of hospitalization. And so, if you think about the child, certainly their lungs are still developing, as I said, but if they're being hospitalized, they're missing school, they're missing activities, and their parents may need to take time off from work. So these are things that we want to prevent. Our current federal view of children's health is how do we reduce chronic disease? And, if we are exposing them to pollutants and causing respiratory problems, we are setting them up for chronic disease. And so this is another thing for us to think about of how do we address the health, not only of Maryland, but of the nation. Proximity to coal-fired power plants have also been noted to cause low birth weight, preterm delivery, and very preterm delivery. And these things, again, the fetus is still developing. And as I said, there's these critical moments of development that we don't want to short circuit. We want to make sure that the child has every chance they can for a healthy future. And so if a child is born low birth weight, preterm, or very preterm, those organs have not fully developed. So the child, even low birth weight, takes time then for them to catch up. It also affects cognitive ability. And we see the same thing in preterm and very preterm. My colleague, my other co-director of the Mid-Atlantic Center for Children's Health, Michelle Kelly, her research is related to preterm infants as they age, so into young adulthood and adulthood. And they found that children who are born preterm are at greater risk of chronic disease. And so we want to do all we can to prevent that. And so that was a study in Florida, and you can see the same findings in Pennsylvania for children who were born close to coal-fired power plants. They also see that proximity to the coal-fired power plants, children have had a reduced head circumference at birth, and even as they grow, they don't really catch up. Their weight stays low up to 2.5 years of age, and this is this is the length of time they studied the child. They didn't go further on, but a lot of times we see that children do catch up. But again, the relationship to exposure to these air pollutants, we see that it does have effect on the children. There's an end product of coal combustion called coal ash, and these are the very fine particles that end up in the filter, and they're used actually in construction. They're used in making cement, and in some places they're starting to use them in the roadways. And so this coal ash can escape and get into the air. And you can see this rather scary list of things that are in coal ash. The silica are little, sometimes you'll hear them referred to as like sand or glass particles. Again, you don't want any particles in the air, because I said how they can get down into the lungs. The cadmium and chromium can all cause respiratory problems. And so again, we don't want to set the child up for possible asthma, or as they age, having some chronic respiratory diseases. The iron can also cause respiratory and flu-like symptoms, as well as the calcium. As I said, the polycystic aromatic hydrocarbons cause a variety of cancers. And then you may have heard about PCBs, and they also cause respiratory problems. So, and eventually can cause problems in all organs with enough exposure. And then again, the heavy metals, in this case, arsenic, mercury, and lead. And as I said, these heavy metals are neurotoxins and can interfere with neurological development. The interesting thing is that EPA regulates coal ash and does not consider it toxic waste, after I just told you kind of the recipe. So that is very concerning, especially someone who worries a lot about children's health. But what the current, this is just off their website, the EPA's website, is they are trying to shift regulatory requirements to the states. So this is an opportunity for Maryland to engage in strong regulations. And that's really what we need to do, is try to get real strong regulations at the state level. again, to protect the children as much as possible. The thing to think about with air pollution is that it doesn't stay in one place. And so some of the studies will have, a radius of 30 miles around a specific site. But depending on the weather patterns and the topography, that we may see air pollution, move anywhere from 12 to 1,200 miles. And we saw this last summer and the summer before with the wildfire smoke. And so, we had smoke coming from either the west or from from eastern Canada. And, we were experiencing wildfire smoke. So it doesn't stay put, even though a lot of the studies are in, closer proximity. We need to think about that. And again, recognize that even though something may be going on in the county next to us, we may be experiencing those problems. And I have a picture where I'm going to show you a little bit of some of the issues that can get involved. For natural gas, some very similar things that we see, but it's important. I'm going to talk about kind of the infrastructure of natural gas, because I don't know, unless you're really attuned to it, you don't think about it much. What is happening is from the sites, the fracking sites, unconventional oil and gas development, we have pipelines that are coming through our states to provide people with gas or to export the gas. And this is just an example of, it's the red lines are the pipelines that are coming through. And this is from one particular gas company. These are their pipelines from Eastern Gas Transmission and Storage. I'm not saying anything about, whether this is a good company or a bad company. This is where their pipelines are. And the thing to think about with the pipelines is that these are federally regulated. So it kind of becomes a problem to have much to say about it. And so then we get into how do we protect people. And when the pipelines were coming through my state, I'm from outside of Philadelphia. And so the pipelines were coming through actually my county. I have a picture of that a little bit later. I went to my health department and what are we going to do? And they pretty much said that we're not going to do anything because it's federal. So again, we think about what are those policies that we need to put in place to protect people locally related to this development. So along the pipelines are things called metering stations, and these monitor the flow and pressure along the pipeline. And this is a photograph of one. And you can see in this particular picture, a housing development behind them, and it looks like a new housing development. I always get pretty anxious when I see things in a new housing development because it tends to be young families. And I've seen out in Colorado where they've got fracking sites right near new housing developments with bicycles right near there too. So again, a reminder that children are being constantly exposed. So the health risks that we see from these metering stations. So even though this is just monitoring the pressure, there are times where they might have to release the pressure, and there can be planned releases as well. And so there can be leaks of these gases that can get out into the community. So what we've found is worsening or development of asthma, people complaining of headaches and fatigue, lower and upper respiratory complaints, again, low birth weight. If women were pregnant during the time and exposed to this, babies born with congenital heart defects or neural tube defects, thinking about the neurological development and some of those exposures that I talked about that could affect the neurological development. And then extreme heart failure, and that's not related to children. This is a general list. And then also anxiety and mental health effects. And this is an important one that is often overlooked. I did work in Northeast Pennsylvania in fracking communities, and that was the primary concern of people. It's just they were so anxious, and some of them were suffering from depression related to it. So there are things that we need to think about, not so much for the children, but perhaps their caregivers. And if the caregivers are struggling, it makes it more difficult for the children. So we need to think about that. I also want to say with the natural gas, there's a lot more research related to children with coal-fired power plants. And with natural gas, it may just be more general. So I'll let you know. I mean, obviously, when you say babies born, we're talking about infants, but this list is a comprehensive list, not just related to children. And so we've got the metering stations that are monitoring the pressure. And then every 50 or 60 miles along the gas pipelines, there are what's known as compressor stations. Both the metering station and compressing stations may look different. So they don't all look like this. There's one not far from where I live that has it all enclosed. So it looks like it is like a county building. Like it doesn't look that different unless you know what's going on. So they've got it all enclosed. So this one is more out in the open. And it depends on, you know, what the company decides to build and what the community kind of will allow to be built. The one that is in an enclosed building is in a fairly populated county and a very populated town. So you know, this is what we are all living with. And so these compressor stations help push the gas along, and like the metering stations, they do have planned and unplanned releases. When things, you know, the pressure starts to build up, they will release it. I've been next to some of these compressor stations in Northeast Pennsylvania, and not only do they make noise, but sometimes they vibrate, and they vibrate all the time. And so people who live nearby will complain of things, you know, being shaken off their shelves, and that constant vibration, adding to kind of the mental health issues. And then what they've also found with compressor stations is problems with elevated benzene, which is a known carcinogen, and they found that indoors, and as far as 2 to 17 times safe limits. And so again, these are problems that you for people who live near these issues and the infrastructure. And as I said, it is not just in rural areas. They have to move the pipeline along, and it may go through more densely populated areas. And rural areas, you know, these once bucolic, you know, beautiful mountainsides or wherever are struggling with those changes as well. So the health risks that we see from venting is odors and burning of the eyes and throat and skin. So when we think about the chemicals that I just talked about earlier, and people complaining about burning and throat irritation, you can see where it's popping up, that the symptoms that people have. The other thing that the Environmental Health Project has noted, and that is the Environmental Health Project is an organization that focuses solely on unconventional oil and gas development, and it is located outside of Pittsburgh, an unconventional oil and gas development related to health. And so they're a great resource, and I have the website for you at the end. But they found that also there is radioactive particles that can be in the gases that moves along. And so people then will complain of nausea and vomiting for short-term exposure. Long-term exposure can cause anemia, cataracts, fractured teeth, and lymphoma and leukemia and other cancers, or bone cancer. So this is not far from where I live. I live in Chester County, Pennsylvania, not too far from the Maryland border. And this is a metering station. Okay, so I did say that can have some problems with air pollution as well. So, and the metering station just monitors the pressure, just as a reminder. But this, and I wish I had a kind of a landscape or a panoramic photograph, but trust me, this is on a well-traveled road, but not a highway by any stretch of the imagination. And about 1.5 miles up the road is a housing development of houses $1 million and plus. So these are, this is a very affluent community, and this is what they've got right near them. And actually, I bet very few residents even know or pay attention to what this is. And so that's the thing that, again, being aware of what's in your community or any communities that you serve, and then looking out for those sort of things. I'm talking primarily about air quality because that tends to be the biggest culprit, but not far from this site a couple of years ago, when they were bringing the pipeline through, some people with residential drinking water wells had some contamination issues too. So that's other things to consider, but I'm limited on time, so I'm just talking about air quality. With natural gas development, they've found that, and this was a study that made the national news, that during the prenatal period, children that were exposed during the prenatal period, there was an increase in acute lymphoblastic leukemia, and then short-term exposure, like other things, was associated with hospitalization for children. So how do we reduce the risk? And there's a lot we can do. This slide kind of has a comprehensive list, and then I'm going to get into some of the details. But the ones in yellow are the ones that I'm not going to get into the details, but I want to make sure I mention. State and local policies are really important now. And so, you've got a governor that is supportive. And so, grasp on that. And try to do what you can related to zoning. Again, these are federal pipelines, so it does become challenging. But then strengthen your air, water, and soil regulations. And I add soil because whatever goes into the air comes down. And so we have problems with soil contamination as well. There are opportunities. We're going to talk about some air quality things, but one of the things with our federal EPA air quality index is it's not really local. So there are opportunities to work with university researchers to get more local data for yourselves. It also can maybe help a PhD student with their research. And I know that Hopkins has an air quality lab. I'm sure that University of Maryland does. And, Maryland has a great group of great universities in your state. And so look around and see who can help you with that, and get the data that you need. Because things, can get into the soil, look at what may be tracked into the home. And so this is working with individuals, talking to people about taking their shoes off. That can make a world of difference. Frequent dusting with damp cloth, because, I said benzene was in the dust in the home. And so, trying to pick that up. You can use a microfiber cloth. Not everyone likes that because of issues of microplastics. So, but I do know it does get it up. And then for poor air quality days, think about the same thing that you do that we were told to do for wildfire smoke, of closing the windows, staying in rooms with fewer windows, close the chimney flue, set the air conditioner on, recirculate. Look at the HVAC system, and if someone has air conditioning or heating too, have the highest level per the manufacturer for the filter. Keep that filter clean and changed. And then also consider an indoor air purifier. And I have to be honest, I just bought one because of the wildfires we have been having in this on the East Coast, the wildfire smoke. So this is, if you're not familiar with the EPA's Indoor Air Quality Index, this is kind of what it looks like. And the nice thing is it's got it color-coded from green to hazardous. And actually we were in maroon the summer of 2023 when we had that wildfire smoke from Canada. So this is a great thing for you to look at. Thinking about children and their developing lungs, they would be in the sensitive group, so they shouldn't be running around and doing things when it has reached orange. But depending on, we're having hotter days now. And so depending on that, even if it's in the moderate range, you want to kind of include both of those, the heat and the air quality, and consider recommendations for children being outside and playing. There is a way for you to monitor your air quality on a app known as Air Now, and this has been developed, it has a lot more very useful information. So it gives you the air quality index. You can see this happened to be green, so we can, full speed ahead and do what we'd like. But then it has the forecast for the next week, and so again, you can plan your week. And if you work with people with respiratory disease, children with asthma, this is a very helpful tool. But as I said, it doesn't measure local, like really local, like your street. My air quality monitor for EPA is about 25 miles away. So, the wind or things could change. And so there are opportunities for that too. And I'm going to get to that. But before I move away from air quality, the EPA has a flag program, and we have a couple sets of flags. So if anyone's interested, we can get them to you, where you can put the flag up based on the projections for the air quality for that day. And so if it happens to be green in the morning, but the projection is that it's going to be yellow in the later in the day, you would put the flag up for yellow to let people know to keep an eye out and take the necessary actions. This program was developed for schools and for planning for children with asthma, but there's no reason why this cannot be put on another public place, a library, if they're amenable to it, a place of worship, any place, to let the public know what the air quality is. There does need to be an education piece so that they know what the flags mean. And you also need to have somebody, it's kind of homework. You need to have somebody who's willing to change the flag every day. But that's a great way to let the community know what's going on. I said about local air quality. There is a program called Purple Air. You do need internet access where you can have a monitor at your home. It does monitor PM 2.5, the fine particles. And so that is also a pretty good indication of air quality. So it's not, you're not going to get all the chemicals, but it does give you an indication of there's an issue where you are. The other thing is this crowdsources. So you can see what's happening, a street away or a couple streets away, or as this, you can see this is across state lines, you can see what's happening. And then finally, you can report violations. And so this is an EPA website that has to report environmental violations. And so if you find that, there's always an odor from a particular compression station, or there's, people are always complaining of headaches, or you can go ahead and report this. If it is an emergency, certainly call 911, something, an explosion or something like that. Please call 911. But this is an opportunity to be able to report that there is a problem. These are the resources that I said. I did mention environmental health projects, certainly us. At Mid-Atlantic Center, we can help you navigate or find information. And then the American Lung Association has a State of the Air report, and it does break it into counties, and it breaks it into number of children that are at risk for asthma related to air quality. And so it's a nice source of data for you. And thank you. I know I ran through this quickly, but I wanted to make sure we had a chance for questions and also a chance to discuss what's happening where you are.
Wonderful. Thank you so much for that presentation. I know our audience learned a lot. I took plenty of notes myself. So we did get a couple of good questions. So one question that we got is coal burning the primary source of environmental mercury contamination and the leading cause of mercury contaminated seafood?
Yes, it is. That is exactly right. And so again, that the mercury from the coal burning gets into the air, and then it, as I said, whatever goes up comes down, and so it comes down in the form of rain and then gets into our waterways, and then that whole issue with long-lived fish being higher in mercury.
And then I had another question about sort of sometimes energy generating facilities are co-located. There'll be several in one area, or they'll be next to a major roadway where there's additional sources of air pollution. So sort of um, how do you think about exposure, or, when, we've talked about specific fossil fuel pollution and exposure, but a lot of times people's lived experiences are next to several emitting facilities, or again near major roadways. Like how do you think about exposure to multiple sources of pollution when it comes to health?
That is a great point, because we live in almost a toxic soup. I hate to be so negative, but if we stop and think about it, I don't think we'd do anything. But I mean, the studies do, just to go back to the research does separate that out and are able to figure that out. But for us, we're all still being exposed. So again, we need to make the wisest decisions that we can. Ideally, if we could go more electric cars and reduce those emissions. I'm a big believer in, if it's safe to do it, active transportation, walking or biking. So again, you're getting exercise and reducing those emissions. But for some people, they don't have a choice. And they live in an area with high transportation and high exposures to our fossil fuel generators that make energy. And so for them, we need to do the best we can to help reduce their exposure, but it can be really challenging because, again, in neighborhoods that are almost blighted with those things, the housing stock tends to be not of, they may not have good replacement windows, and so things are leaking in. And so we just need to do the best we can. And I hate to be a cop out, but that's people's, unfortunately, some people's reality.
Yeah.
And we all need to do better, I think, as a nation.
Yeah, and I think there's efforts to address at the permitting level cumulative impacts. And so I know if folks are interested in Maryland, you can certainly get involved with Maryland League of Conservation Voters to learn more about opportunities like that to sort of, you talked about a lot of tools for patients and their parents and their families to be aware of risk, and then how to mitigate, your family's risk. And then, which is a really important lever of change. And then another important lever of change is that sort of systemic level policy change. And I think we have really complementary opportunities to offer for our participants in the arena where they feel most comfortable getting active and making change.
Yeah, yes, and you're absolutely right. I mean, that kind of comprehensive thing of all those exposures. I mean, we could go on about the impact of, the epigenetics, the changes that occur, and how it affects, generations. And so it is awfully, and I mean it in a way of awful, complicated, and we need to really all do the best. And those of us who have more opportunity really need to be the voice for those who are struggling.
And I'm curious how you approach talking to patients and their parents about environmental exposures and the risk, because like you said, sometimes first of all, trying to figure out through conversation with young patients and their parents, how do you figure out if it is an environmental exposure that could be exacerbating asthma? Like, are there tools for practicing health professionals or medical professionals who see patients to sort of try to get at, is there an environmental source that we could help mitigate, that's exacerbating this symptom? And then how do you talk about it with your patients without being overwhelming? Because like you said, it can be overwhelming when you learn all this new information, or you feel like you can't address it because it's an environmental exposure. So sort of a two-pronged question on how you have these conversations with patients.
Okay, so for the clinical side, of how do you determine if this is an environmental exposure or not, two things. One of the problems is that most of our medical schools and nursing schools don't include a lot of environment in their education. It's starting to get better, but most of them don't. And so with that, and that's one of the reasons we exist, is to help healthcare providers navigate that. So that's one of the things. But a lot of times we do as thorough of a history as we can. So we ask people, how long has this lasted? What kind of things were you doing? And then we'll say, like, I will, depending on what the symptom is, where is your water source? What, so we kind of start diving deeper of what is going on. And then a lot of times we get a lot of mold calls too. So people with respiratory problems with mold, is it better when you leave? We ask those, so it sounds so simple, but if you're not attuned to other things that could be causing it, such as environmental things, people don't ask that question. So that's among the work that we're doing. And the second question, I'm trying to remember what that was. That
How does it not become overwhelming, like in conversation?
Yes. And that's what I love about this job is kind of talking the parents off the cliff, right? Because oh my goodness, my child was in nursery school today and they burn a candle and there was lead in the wick or something. So we try to I try to say, this, when we stop the exposure, it's going to clear. And I usually will tell them how quickly it clears, depending on what it was. And most of those exposures are not, acute, where somebody was, drank something that, sends them to the hospital. So I kind of, and I also say, and I don't mean this to be cynical or anything, but people are not dropping dead around you. So I just really try to normalize it of people, we're all going to make it, but let's stop doing whatever's going on. And then if it is more severe, we will send them to a toxicologist to, work them up. And we're successful with that parents, I think they just need somebody to talk to and say, it's going to be okay. But now let's stop doing that and remove them. And if the child ends up with asthma, there's things that we can do, and when there's things that we can manage the asthma, and then keeping an eye on air quality can prevent exacerbation of the asthma, that kind of thing. So we try to keep them calm. It is scary. It's scary.
Yeah. So one big topic right now that's related is energy affordability. We're seeing a lot of people, especially in this region, that's all under the regional grid operator, PJM, topic for a different day. But we've seen prices really go up, and people have to make really tough choices about, paying for healthcare, paying for energy. And it's a big topic right now, how to address energy affordability. And it's interesting because health costs from something like fossil fuel pollution, you ran through a number of health impacts from children living near, fossil generating facilities. But I am seeing that not as much in the conversation. We're talking about, okay, if we need a new energy source, we need to build a new energy source. We're not seeing the health costs sort of in the equation, right? And really, I think it deserves a bigger place in the conversation when we're looking at the lifetime costs of an energy generating facility, and when we talk about energy affordability and what it actually means to the cost of households, of people. And so have you seen good examples of where health costs are being included in these types of decisions?
Europe. That what we need to do is do an environmental impact assessment when these things are added in, and so that would include then, we need energy. So what the cost of that, but then the overall cost of health, for that community. And so, and it's not something we typically do in the United States. Some places are starting to do it. But if we could, again, think about policy, that any change, there needs to be an environmental impact assessment. And that could probably be managed at the state level. I'm not a big policy person. You would know that better than me, but it would seem that you could have that as a Maryland policy. But that's really important.
And we got one good follow-up question from our conversation we were just having about clinical visits, which is, do you have specific screening tools to help determine?
Yeah, you know what? If that person can send me their email address, I'll send them to you. Or do you want me to send them to you, Rebecca, and you can have them?
Sure, we'd be happy to include them in any follow-up.
Okay. Okay, one we just did one specifically for lead, mainly because it can be really challenging to figure that out. So we have a whole, it's many questions, but there's some others related to heat, and yeah, I can send those to you.
Wonderful. Well, I think in these times, I like to end conversations with sort of what's giving you hope these days. And so can you talk about a hopeful thing to end on?
Well, I have a new grandson as of Tuesday, so that gives me hope. These kind of programs that it's, because sometimes we get in our own little bubble thinking that we're the only ones worrying about it, right? Just the pediatric environmental health specialty units, but to know that other disciplines are worried about it too, and educating people and our policymakers, like Governor Moore, that he, is on this. That gives me hope.
Wonderful. Well, thank you to everyone for joining us today on this Children's Environmental Health Day. We're so thankful, Dr. McDermott-Levy, for being here today. Thank you to Megan for being here to kick off the webinar with a Children's Environmental Health Day proclamation for the state of Maryland. If you want to get more engaged with any of the organizations you heard about today, you can check out our websites, and we'll send them all in our follow-up email. There is an important survey in the chat for you to help. Your input helps improve these webinars. And we'll also send a follow-up separate. You'll get all your follow-up emails from Maryland League of Conservation Voters Education Fund, except if you needed nursing continuing education. That is a separate process, and you'll be getting a separate email about that. So please look out for that. With that, thank you again for being here, and everybody have a wonderful day.
Thank you so much.